to the Pause It podcast. I am Dr. Sam, and with me is, as always, is Dr. Robert. How are you?
Hey, Dr. Sam, how you doing today?
I'm really good. And so we are doing this podcast before Christmas, even though it's going to come out the week of Christmas. And
Yep,
so we wore our ugly Christmas sweaters today.
that's
I
right.
feel
And I
like
love
maybe people
yours.
should vote on who has the best ugly Christmas sweater. That's kind of what I think should
Oh, I
happen.
like that. I like that. I think you're gonna win this one though, because
I
it's a good
might.
chance.
I might, but here,
Um,
why don't you have to stand up a bit and show off yours because I do like the T-Rexes.
so it's T-Rex's. Everybody loves that. That's really all it is. T-Rex and my favorite drink. You can say it's Coca-Cola or beer, depending how you
Beer.
look at it.
We all know
Beer.
what it really is.
So that's
And
mine.
then,
What about you?
well, in true form for me, mine features a French bulldog. Oops. Oh, there you go. And
There it is.
it lights up.
That's where I think you put it over the top with the lighting up. I think honestly that's the best part about it.
Yeah. I have my thing on blurry, so I have to find just the right plane to show off.
Just going back and forth the whole time.
Yeah, exactly.
So
So,
we'll be taking votes, and what should the competition be? I feel like we should make a competition.
ooh,
I
that's
should
a
have thought about
really
this ahead
good
of time.
one. There should be like a dare involved, I think. Like maybe at the next thing we're at together, so in Orlando in January, like one of us will have to do something. I
Yeah, we'll
haven't
take
really thought it
suggestions.
through just then. What?
We'll take suggestions from the audience if they can
Take
think of a good
suggestions.
dare.
Exactly.
So
What should the dare be? If we can't think of anything else, it'll just be I have to buy you a drink or you have to buy me a drink. I mean, that's fine. That'll work
that
out just
sounds lovely. I'm okay with that option as well.
fine. And so I think this holiday I plan to eat a lot of fattening food. How about you? Do you plan to eat a lot of
I
fattening food?
This is literally my second favorite holiday behind Thanksgiving, which is more food. So
Yeah.
it's a lovely holiday.
So if you were a dog though, what would happen if you ate all that fattening food? Just thought I
I
should
don't
do a
I don't
little
know,
bit of
Sam. That's
leeway
a
to what
leading
we're talking
question.
about today.
Well, they might get pancreatitis.
That's what we're talking about today.
My God. Oh man,
Oh
it's
goodness.
funny.
Can you tell I'm a little punchy today? It's because I worked my last day and now I'm on Christmas vacation. I mean, I have a lot of records to do before I can actually call myself on vacation, but
Hey, I didn't know it says your last day. That's nice. That's nice to have some time off for the holidays.
yeah, I'm pretty excited. I don't actually have to be back again for exactly 1 week. I'll be back next Wednesday. So that'll be good.
Well, you have a good boss, at least from, veterinary boss. You're my Balto boss, sucks. Put you to work the next couple days.
Yeah, he's just ridiculous and I just can't even handle it. Robert. Anyway, so um but pancreatitis is what we are talking about today and so I'm going to say that you probably treat a lot more pancreatitis than I do. So I kind of think maybe, well, number one, I'll definitely defer to you for sure many times in this. Um, but also too, like there's a pretty big difference even just between like how they'll present in cats and in dogs.
Mm,
Um, right. And like, do you think, and maybe that one seems to have more issues with chronic pancreatitis than the other, I think.
absolutely. Yeah, I
Yeah.
would say cats by far have more of the chronic because every time they do an ultrasound now for a cat, it's got like chronic active pancreatitis,
Right.
which means like it's just kind of slowly ongoing, and a lot of it's to do with their underlying diseases. Sometimes like certain things will
Hmm.
predispose your pet to having pancreatitis, and
Yeah.
that's a good place to start in the first place. Like, why do your pets get pancreatitis?
Well, or
Um,
maybe even like going a step ahead, like what's the pancreas? Because I think a lot of people don't even know what that is.
that's a great. That's a probably that's a great place.
See, this is
I
the
mean,
difference between being a daytime vet and an emergency vet. I do a lot of explaining the very basic things.
I'm like your dog has a really mad pancreas, and we're gonna fix it.
We're gonna fix it.
Yep. Yeah, I think the biggest things I think that people should know about the pancreas is that it just really helps you digest those fatty foods.
Hmm.
And
Food in general,
our
digestive enzymes.
exactly all that stuff. And the reason we enjoy our pancreas so much because it does a really damn good job. But in dogs and cats, sometimes it. I mean, I'm surprised. Like maybe people get it too. Is I'm not sure how
They
often, but
do.
cats and dogs get it all the time.
Yeah.
Um,
No, people do. People get pancreatitis, for sure. I can't say that I know enough to know what predisposes them, but I had a friend that had pancreatitis. So, I mean, I know for sure people get it.
Well, it sounds
Absolutely.
horrible based on when we see our patients because it's got quite the spectrum of like how they can present. And I guess we
Hmm.
can get into that a little bit, but it's like they can come in just. I mean, they probably you probably see more of the beginning stages. What often do you see when they come in for pancreatitis for you?
So usually we're gonna see, it depends on if it's a dog or a cat, right? So I do think that the
Mm,
presenting signs are slightly different.
yeah.
With dogs, when they're really down and out, like they're usually vomiting, they're
Mm,
usually not wanting to eat, they're painful in their stomach. Like when you go to just palpate, they're like, right at that
yeah.
in that front part of their stomach. Um, that's not the only thing that we see cause that. I mean, there are other GI things that do, but I think there's a certain area when you're feeling their belly that you kind of can see them being painful.
Mhm.
And so I think for me that's probably one of the biggest things because I do think it's really painful. Um,
Yeah.
Cats are a little more variable about whether or not when you squeeze on them, they don't seem to be as painful, but
Yeah,
they're
I would agree.
cats and so maybe they're masking it. Um, Interestingly enough, with cats, a lot of times it's just that they are not eating. Like that's probably one of the biggest signs is the anorexia.
Absolutely.
Would
I
you
would agree.
say? And then one thing that I didn't actually realize because I was just reviewing pancreatitis stuff because like I don't probably see it as much as you, and I was like,
Mm.
I guess it's really important that people know presenting signs. I didn't realize cats are more likely to have lower temperatures than higher temperatures.
Yeah, cats don't like to read the book. They're annoying.
No, not at all.
And that's funny because like that's not the case necessarily. I think heart failure they don't always follow that as. Oh, yeah, actually, sometimes they do with heart failure. I guess we see it a lot of times with like chronic kidney disease too. For some reason, like when cats have chronic kidney disease, they're always having a low temperature too. So
Oh,
I think
yes,
that's
I
just
do think that
how
that's true.
I think it's just their circulatory system and how
I was
they
like their
function.
perfusion. Yeah, yeah.
Yeah,
Not sure why that happens with the pancreatitis though. That I'm not sure that I can really explain the pathophysiology there, but they
maybe
can
they're
they
releasing.
can have a temperature, but like a fever. But yeah, I guess it's more likely that they'll have a lower temperature, which just made me kind of rethink some cases where I was unsure about things, like, oh,
Mhm.
that's interesting. So it's always good to review and see, because I just
Yeah.
kind of went back and was like, oh yeah, I guess I hadn't thought about that for a while because I just, don't really just kind of see it present that clearly in cats.
No, I would agree, and I think that's it's funny because like back when you and I were in school, like we learned so many things so quickly,
Mm-hmm.
and I almost now would like to go back to school and like revisit some things. I was like, oh yeah, there's an association there that I did learn that way back when because you just learned so much at that time, and you're starting to see the associations now that we're working consistently. But
It's like drinking from a fire hose. I honestly think that probably there are some classes that I would just like sit there like, I didn't hear this the first time. There are some classes I don't want to repeat, but there are some classes I would 100% want to do over again.
all right, well, fun question in the middle of this:
Yeah.
what class did you not want to repeat?
Oh, I mean, one, can I give you a list?
We'll start with one.
Um, because I don't think it would be helpful or because I thought it was one of the least interesting classes we ever had.
I think either one, as long as you give an example. Which one do you think is?
Oh, okay. Um, I think that I would not want to repeat. I gotta think it's got to be a hard class. Probably theriogenology
Oh, that's a good
is
call.
gonna be one of the ones that was literally the biggest waste of my time
Yeah,
because I don't
that's
do it. That is reproduction for anybody who's listening and is like, what in the hell did she just say? Because it was really like seriously a waste of time for me.
yeah,
Because I will never ever have to make a get a cow pregnant or a horse or and like the small animal theriogenology we did was such a throwaway. I don't really feel like it
yeah,
was that helpful. It was like 2 lectures out of an entire class of like this is there were a few times in our curriculum where I really wish they would have let us track and they
yeah,
didn't. And I will say that for the boards, and so for anyone who's listening who's like, what is she talking about? This has nothing to do with pancreatitis. That's true. So tracking is like we both went into small animal, but we had to
mhm,
do everything. We had to do large animal, we had to do all that stuff.
yeah,
Um I think that doing some of it was helpful. Like I know people who went to Purdue, they tracked and they never did any of that and they studied for it just enough to pass the boards. I
yeah.
do think it helped us pass the boards that we had some of that. Um,
Oh, absolutely.
but truthfully, like I could have just gone to and done like some of the externships with it and been fine. Because doing medicine, whether you're doing it on a cow or you're doing it on a horse, is still the practice of medicine. You're still learning the diagnostic process. And I don't mind that. I liked comparative anatomy. I learned a lot that way. Um, but some of the like nitpicky, especially theriogenology, I was like, I would like to stab myself in the eye. Like this is horrible. I hated it.
I want to stab myself in the eye. Well, that's going on the quote of the podcast.
What about you?
Do we have a nutrition class? I feel like we did, right?
I'm gonna be kind. Sure, we did.
Okay, that was my. I thought we did to some extent. I think it was not as helpful,
It
being
was
that it
not.
comes up all the time now in literally every conversation, whether it's like how their pets lose weight, why they got sick in the first place, how to
Yep.
manage diseases, the questions that people ask, like grain free versus raw diets. I think it just comes up, and that's why we're having that nutrition month coming up eventually.
Yeah.
Um, it's just such an important part of like our conversations, and I feel like I was very underprepared for it. Get out in
I
school.
agree 100%. And I think we had during a different class, we had one biochemistry teacher come in and
Mm-hmm.
teach us the like teach us more about nutrition in 2 lectures than we learned in an entire semester in small animal nutrition.
Yep. So
Do you remember that? Dr. Pasak, I think was her name. Like she came in and I was just like, what is all this information? And it was amazing. It was so good. But she taught all the technicians nutrition. She never taught
okay.
and she was a veterinarian, but like we didn't get her.
Yes.
And I was
No, we
like, can
didn't.
we petition for her? Like, do you remember when we did
I
like curriculum reviews and like that was one of the biggest things that everybody in our class agreed on is that like nutrition, we need a scientific nutrition class where we
yeah.
learn actually how to like refeed animals and how to do like clinical nutrition for sick animals and things like that, which we really, I mean, I had to learn that stuff after the fact.
And I think that really ties back into pancreatitis because part of the reasons your pets can get pancreatitis is because of poor nutrition, eating people food and so forth. Being
Oh yeah.
overweight
Oh yeah.
predisposes you to getting pancreatitis.
Mm-hmm.
But also the reason you get over pancreatitis sooner is by feeding. Like you start feeding them
Right.
right away. Even though they don't want to, you put an NG tube down their nose and you feed them because the sooner they start eating, the better chance they have of getting out of there at a reasonable time frame.
Right. Right.
So
And I guess like I guess what that means though too is that like so when you have an animal that has pancreatitis, for like real pancreatitis, not like, and I think maybe that is something else we should talk about. Like, so when your animal goes into the vet, they're usually coming to me very often first, where we're going to do the initial blood work or something like that. Just because they have elevated pancreatic enzymes does not mean that they have pancreatitis. And I think that that used to be considered a much more reliable, like, oh, their amylase lipase is up, they must have pancreatitis. And the fact of the matter is, the pancreas can get angry. It's right near a lot of things that become inflamed anytime they have GI signs, liver issues. And so pancreatic enzymes can increase just as they're pro-inflammatory. They just can get they can
yep.
elevate, and it doesn't mean they have pancreatitis. And so there are other tests now that are more helpful. The thing is like we don't see enough of it, so we don't like I don't have CPLI, I don't have the FPLI, like I don't have those snap tests. Do you have those?
We don't have them, and honestly, I don't rely on them that much because they can be positive, but so they'll like your vet will tell you, hey, your pet has elevated CPL or CPLI, and your dog has pancreatitis. Like not always. Sometimes,
I was going to
uh,
ask you this because I just had a dog come in the other day. And again, I don't have these tests, so I don't rely on them, right?
yeah,
So this is a really interesting question. So they said, "Oh, well my dog had pancreatitis." And I said, "Well, how do you know your dog had pancreatitis?" And they said, "Well, they told me they had this test and it was high." And I was like, "Okay." I was like, "Well, that just means that they couldn't say he didn't have pancreatitis, but it doesn't mean he actually has pancreatitis." Like really anything that's causing inflammation of the pancreas can make that be elevated, and it doesn't mean they have actual pancreatitis. This animal was
exactly.
not hospitalized, didn't have to stay overnight, got outpatient care. Maybe their pancreas was inflamed, which is what pancreatitis is, but true
Mm.
pancreatitis, this is when they're on IV fluids in the hospital needing like nursing care. I mean, do you agree
Yeah,
or no?
what I'll say is I hate pancreatitis for a lot of reasons. One is because it has such a diverse range of symptoms and severity. Like I've
Mm-hmm.
seen dogs come with pancreatitis. We did an ultrasound. We and ultrasound's about 80% confirmatory
Yeah.
of
Yeah.
pancreatitis in dogs, cats a little less. And then the next test is like a test we send to Texas, which is probably the most accurate, but it takes a couple days to get back. And by that time, you're already treating the disease, so it doesn't really matter. But the dogs come in and just vomit once, and they'll be fine with supportive care. But I've also seen dogs literally be hospitalized, like you're talking, for a week or never leave the hospital because of how bad they get a necrotizing pancreatitis, which is a
Oh,
really bad
yeah.
pancreatitis, or they can have an abscess form in their pancreas, also really bad. Um, so those are kind of the two big ones that will keep patients in there longer. But yeah, I'll typically see them hospitalized for a couple of days, and it always messes with every other disease the dog or cat has going on. Like
Yeah.
it's always the diabetic patients, and it messes with their blood sugar the whole time. So you're fighting
Mhm.
blood sugar, and you're trying to support their pancreatitis, and it's just
Well,
a
and
heavy hot
also
mess.
too, pancreatitis affects the pancreas, and I mean, frankly, you need a functioning pancreas to make insulin and to be able
Yep.
to not be diabetic. So there
Yep.
is the other part of the function of the pancreas. I guess my point for what I was saying isn't to say that you can't have a mild pancreatitis. You can
Oh, oh
have,
yeah,
like
yeah.
you said, have a mild pancreatitis, but I think that people call anything that looks like in that like everyone
Yeah.
says that's pancreatitis, and I do think that maybe that gets overdiagnosed for
Oh,
things that are
absolutely.
just like maybe a like a dysbiosis or a like any
Mhm.
sort of so meaning like something is imbalanced in the gut or something like that where yeah the pancreas is inflamed but I don't know like I just feel like that gets thrown around quite a
Oh,
bit.
I would agree. Because I think half the time it's just like it's an easy answer for
Mm-hmm.
veterinarians, it's an easy answer for owners, and everybody kind of relatively understands it. But when you
Mm-hmm.
tell someone your dog has intestinal dysbiosis, one, you can't really prove it. But two, it's probably more common than we anticipate because all it takes is just an overgrowth of bacteria in your gut to cause it. So it's not like it's a, and that can happen anytime a dog eats stuff off the floor.
Well,
Um,
and one thing too, like when I was reviewing everything, I never really think of trauma as causing pancreatitis, but it can. And I never really thought of that, truthfully.
I mean, I haven't seen it in a while, but it definitely can.
Yeah.
Pancreas is very sensitive, and we see a lot more iatrogenic pancreatitis for like when we're in surgery and someone like
Mm.
nudges the pancreas or it's taking the gallbladder out or a liver lobe. Then the pancreas gets very angry. It does not play well with others. It's like that lonely kid in the corner you should leave there because this does not like playing with others and gets touched and gets super pissed off
Well, isn't
afterwards.
that the old joke? Don't F with the pancreas. Like
Yes,
whatever you do in surgery, leave
it's
the
so true
pancreas
though.
alone.
Well, like I'm not gonna go into a whole thing about it, but there was a RDVM once that biopsied the pancreas for no reason. And I'm like, and then the dog got horrid pancreatitis. I'm like,
uh,
don't touch. It's like no touchy. Just leave it
yeah,
alone.
don't touch
It's
the pancreas.
just like just don't. Oh God, it was just oh, it's horrible.
I will say I did one time take an take a because I had a cat that we ended up the cat we thought had a I don't remember even why I did an exploratory laparotomy on the
Mm,
cat
okay,
and the cat was so sick and we had to put a feeding tube in and we were trying to figure out what was going on and I took sample of the liver which was
okay.
terrifying and then I took a sample of the pancreas which was even more terrifying because I was like I don't know but and then intestine and the cat had
Triaditis.
triaditis yeah so which again people are like what are you talking about but it's when they have literally disease of the intestine the pancreas and the liver and it's the triad of those three things and so that is something that can happen in cats and I think that's where it gets so confusing in cats is that it's you like a lot of times secondary they can get pancreatitis secondary to their IBD that happens in dogs too though also.
Oh yeah. And like it can make pancreatitis. It makes like sometimes you get a pancreatitis from. Well, put the other way around. Like pancreatitis can cause kidney disease. Like cats will have they can go into acute kidney injury because of their pancreatitis. It just causes so many problems. It's such an angry little organ for being
Yeah.
as small as it is. It's
Yeah.
just so annoying
Yeah.
because and cats like always have this chronic active one, and like you mentioned, triaditis is really common in cats, but that's one of the three pillars of triaditis, and cats don't do well because you have to place a tube in their neck, and it's a lot of antibiotics, and it's tough.
Yeah.
I don't envy treating that one, and I mean, I guess we should probably talk about what do we do to treat for it.
Yeah.
Um, what do you guys? I mean, do you want to start? And
Well, and so like I said, so like sometimes we'll have something that we suspect has pancreatitis, but when we see them, they are the more mild cases, which is why I'm always reticent to say they're actually pancreatitis because I'm like, yeah, their
yeah,
pancreas is probably a little inflamed. Does that mean it's clinically what we would consider pancreatitis, or is it a dysbiosis, a gastritis, like what, you know what I'm
yeah,
saying? Like maybe the pancreas is involved, but if they are responding to just some of that outpatient care, usually we're going to be, if we're talking like a mild case,
hmm
usually we're going to be doing fluids. So we're talking if it's outpatient care, sometimes sub-Q fluids, usually Serenia, something to stop the vomiting, and then like a low fat, highly digestible food,
yeah,
so that we're not challenging the pancreas. But again, too, with those guys that I'm like they need to be hospitalized, I'm referring them out. So I may have a more of a suspicion, but my guess is that they're going to need to be in a hospital where they're constantly getting something to stop the nausea. And like you
yeah,
mentioned, a feeding tube, which I can't do. We can't manage a feeding tube because we're done at 6 o'clock, so we're not keeping
yeah.
them overnight. So we're talking about really mild cases. I feel like when we start to get into days of not doing well, even despite treatment, that's when we're starting to get into, okay, that probably needs to go to a referral
And I think
hospital.
that's a really good time for it too, because most of their blood work isn't. I mean, they can have bad blood work, but it's not usually the reason to hospitalize them. It's like how they're doing clinically, and it's
Yeah.
like you said, usually not eating for a couple of days is the biggest red flag, or vomiting multiple
Mhm.
times. Uh, yeah, those probably and lethargy. I think those are probably big ones. They'll cause your pet to be hospitalized at one of our facilities.
How do you find the treatment for the cats to be different than for dogs, or do you think it's exactly the same?
Honestly, because they get complicated more quickly. I think a lot of times because they when cats don't eat for a prolonged period of time, which happens a lot in pancreatitis, they
Mhm.
develop like fatty liver disease, and it's
I
not a
think that
pleasant
it's
one.
associated so much more often than we think. Like
Hmm.
when you
And
have a cat with hepatic lipidosis, you're really worried about pancreatitis.
yeah, and that's what I think it's one of the big things, like trying to get them. But you don't place as many NG tubes in cats, that's because they're smaller and just most of the time they go right for
They
placing
do
an E tube.
esophageal, yeah.
Yeah, and dogs, on the other hand, we can throw them an NG tube in them pretty quickly. So they
Hmm.
start. I think that's why they do better. Honestly, it's because we can get them out a little sooner. Unless the owner's like in to win it right away with cats, but most of the time you're not like, hey, let's put my cat under anesthesia to put a tube in its neck. That's not like a first day conversation. Usually, it's not even a second day conversation. It's a
Yeah.
they're still not eating after the third day where you know I can throw an NG tube in a dog as soon as it gets there and start feeding it and taking because a lot of times with pancreatitis, your GI tract slows down, something called ileus. So
Hmm.
it'll slow down. You have a bunch of fluid in your stomach. Dogs will keep vomiting and regurgitating. So it's something. It just makes it easier in dogs. But
Hmm.
pretty much the things you talked about, the mainstays of therapy, it's anti-nausea medications, fluids, sometimes GI protectants like you know acid reflux type medications. But I think pain medications is probably one of the big ones, just because
Yeah.
it is uncomfortable.
And that is I think a really big thing is the I think one of the major differences for me, and maybe this isn't right, I don't know, but I'm usually not calling it pancreatitis in a dog unless I think they're painful. You know what I
Mhm.
mean? Like then I'm leaning more towards more of the, dysbiosis, dietary
Yeah,
indiscretion, like that kind of stuff when they are like dumpy and they're acting like they're vomiting, they're, they have ileus, but like I don't see any evidence really of pancreatitis because they're not painful, they're not, you know what I mean. But then those
yeah,
guys that are painful, I'm like, then I'm a little more on the train of like, well, maybe, but cats, again, they're trickier. um and I feel like with dogs, there's a really also a big difference too with breed. So there are some breeds that are just much more
yeah,
likely to have pancreatitis and more likely to have what you said, like the chronic pancreatitis,
yeah,
versus like, so dogs like schnauzers, the dogs that tend to have more fat in their blood,
Oh
the
yeah.
ones that get hyperlipidemia and stuff like that. So they, those guys that always have the blood that looks like
Milk.
yeah, like milk. Yeah, like strawberry milk when you take
It's
it. You're
so
like,
gross.
yeah, I know. We should talk about that one day too. But
Yeah.
whereas like with cats, I do feel like you see a bit more chronic pancreatitis
Hmm.
along with those IBD kiddos. They tend to have that all kind of go together.
Yeah, I agree. I think a lot of it's because of it kind of makes sense when you break down is because IBD, you've abnormal gut flora half the time that
Mm-hmm.
causes inflammation, which unfortunately it's all right next to the duct for the pancreas. So like it just goes and sending infection, causes inflammation. That's why they get things like cholangitis so easily because it just causes so much
Mm-hmm.
inflammation in that area. Sorry, the choroiditis, which is part of that complex. But it's a lot of inflammation. It just travels very quickly to where it needs to go, and that's why they get pancreatitis and they need to be hospitalized for a while. It's rough.
Mm-hmm. Yeah. Um, and I guess as far as with cats, a lot of the time, I'd say like a really high percentage of them, you don't actually have like a cause. It's not like they ate a fatty meal or like you don't actually know why it happened. And I
Yeah,
think that's another
dogs are a
very
little easier.
frustrating thing for cats.
Yeah, I would agree because like cats don't like eat things they're not supposed to most of the time. I'll say it is very like most times it's an overweight cat. Um, that I'd say is, and if you need any reason, keep your pet skinny. Pancreatitis is one of them, and your dogs too. It's always the chubby little terrier or schnauzer that comes with the pancreatitis. If they're tiny, they're more likely to have it. I don't see it happens sometimes in big dogs, but and honestly, if your dog's over the age of or under the age of like 4, they probably don't have pancreatitis. I've I don't see it very often in dogs that are that young. It's always like your older
Mm-hmm.
dogs. Like the can't. It's not saying it can't ever happen. I've seen maybe once or twice, but they're almost always 6 to 10 years old. That's kind of like their bread and butter. They have really bad pancreatitis at that age when they're older.
Mm-hmm. Yeah, and I do think you're right. Like some of those little fluffy breeds, like especially the
Mm-hmm.
schnauzers, like in the dogs, um, and cats. Yeah, I don't know. Cats are
Whole
they
different
don't read the
animal.
rules.
They don't. It's honestly the most frustrating thing in veterinary medicine. It's you tell the owners like these things, and then all of a sudden you're like, well, cats don't really give a shit, so they're gonna do whatever they want,
Yeah.
and
Yeah. I think
here
I
we
had
are.
one of those days today where like I had all the cats today and they were all losing weight and like none of them were losing it for the reasons that like I was expecting. Like everyone
Oh,
I was like,
really?
this one's gonna be no, not thyroid. This one's gonna no, not thyroid. So
One of
like
you must be thyroid.
no, and not one was, and they were all weird. And I was like, darn it. We got more work to do.
More
So
test results to call back with.
yeah, but not one of them had pancreatitis, just so you know.
Oh,
I
there you
don't think anyway. They were all eating really well and
go.
losing weight anyway. So
That sounds like a CKD diabetic. It sounds like a diabetic patient.
it would
But
if they were hyperglycemic, but they're not.
no. Okay.
Actually,
Well,
one of them did have glucose in their urine and no hyperglycemia.
hmm, weird.
Yeah, yeah. We'll talk
They said,
about that
yeah,
another day.
they don't read the book. It's annoying. Whether it's murmurs, whether it's like they can have no murmur and still have heart disease.
Yep.
It's just there's so many things. They're annoying. But they're
I
very
love
cute.
cats. They're very interesting and fun.
Actually, fun thing. That's kind of a side note. I just found out there's a Whiskers and Wine bar. It's like down the street from me. It's got a whole bunch of cats in there. You just have it's like a wine bar that you have cats walk around while you drink wine.
That's so
So,
fun. We have a coffee place like that.
oh, really
You just
nice. That's a
you go drink coffee and hang out with cats. And actually all of them are up for adoption. Like they work with a local
yeah.
adoption place, which is nice.
So I might have a cat soon. Who knows? So I found this place
How would
like
Loki
not.
feel about that?
He's sleeping right now, so really his opinion doesn't matter.
He'll be fine with it. That's
Yeah, he'll
okay. My
make it
kids
work.
are really angling for a kitten. I was like, guinea pigs. Not
Guinea
until the
pigs.
guinea pigs are gone.
I got 2 to 3 years. Actually, how long have you had them now?
A year. And they were rescues, right? So, I mean, they're like 2 when we got them, maybe 3, so it could be 4. I don't know. I
Okay,
clean their
so
cages a lot. They're doing well. We're
that's well,
keeping
that's
them
good. They have
healthy.
them.
We love the guinea pigs.
They're very cute. I actually like the sounds they make. They're very
They
cute.
actually are very cute, and I do really like them. Although some days I am tired because I'm like, I really would like my children to be cleaning this guinea pig cage, but they're 10 and
Nope.
7, almost 8. So I should have known
Never
better.
happens. Yep. I mean, I did the exact same thing to my mom too, so I can't say you're the only
Yeah.
one that's done it.
Well, I
Uh,
did too, but like my mom didn't clean them. So I don't really know who did because I definitely didn't. And I don't, maybe she did secretly clean them and I don't know. Like, or I blocked out that I actually did it or they just weren't well taken care of. But in my
but
mind, I was a good guinea pig owner when I was little.
that's funny.
Yeah.
They're cute. I like them a lot.
Yeah, they're pretty good.
One other thing we should bring up is that there's a new drug on the market for pancreatitis, and that's part of the reason we want to talk about this too.
Hmm.
Uh, the whole point of pancreatitis is that pancreatitis just means there's inflammation in your pancreas, and there's a lot of it. And part of it's because of the amount of white blood cells that go to that area to help fight, whatever's going on at the time. This drug, but part of the reason is it becomes a vicious cycle of pancreatitis. More inflammation means you have an angry pancreas that makes the disease worse, and unfortunately, it kind of cycles back on itself and makes it very difficult for patients to leave the hospital because
Hmm.
your body responds by bringing more white blood cells to that area, and just makes the pancreas even angrier.
Yeah. And for the longest
So,
time, the treatment basically was just get through the symptoms,
yep,
supportive care, no like actual treatment for what was happening. Enter.
exactly. Paniquel. I can't say.
So like you're gonna say what it's called because I
It's
don't
like
know.
I think it's I don't I think that's
I
how you
think you're right.
pronounce
I
it. Put
think
it
it
that way.
is. Yeah.
Paniquel. But it's a cool drug because it actually reduces the amount of white blood cells that go to the pancreas by inhibiting their movement. And
And it's like an actual treatment FDA approved for
dogs, I
pancreatitis.
think.
Like that
Yep,
is for just for dogs, not for cats,
just for
right?
dogs. Yeah, just for
Yeah.
dogs. So it's pretty cool. It's a newer drug. It just came out within the last year, I think, but it was in Japan beforehand, I believe. So took a little while longer to hear because I remember meeting some of the reps at the conference. So it's been in Japan for a while. It's now it's in the States. And one of the exciting things is it can actually the reason we like it so much is it can actually reduce the amount of time you're in hospital. And that's a
Mhm.
very big deal for financial reasons. It's a big deal for morbidity reasons. So your pet, making it through the disease if it is very severe. So it's a exciting drug for that reason because, like you said, there hasn't been a treatment for it. It's just been
Yeah.
supportive care. So I haven't used it yet myself. Have you?
No, we don't have it. But we
Yeah.
don't see we don't see enough of that level of pancreas, like I said, of pancreatitis that honestly, like most of our dogs, we're gonna see mild cases or ones that we are suspecting, but not even like we are getting a new ultrasound, so I do wonder sometimes
Nice.
when like it's really nice. So I do sometimes wonder if if we had a better ultrasound, if we'd be able to visualize it better, would we be diagnosing it more? Maybe, you
Let
know.
me know. I'm curious because something worth looking at because they say I mean, it's easy to find when it's angry.
That and
Uh,
that's right, right? I mean, but like our ultrasound now is fine for big things, but like the pancreas is not the easiest thing to find without a really good machine. And
yeah.
so I do wonder if it was kind of like when we got the machine where we were able to like really do ACTH stims like right away and do get
Oh,
cortisols quickly, how many more Addisonians I have diagnosed. You know what I mean? Like so some of it is like just the
yeah.
equipment you have to do it and your comfort level using it and actually like not just chalking it up to something else. And the fact of the matter is that depending on what's going on, the treatment doesn't change that much, right? Like a lot of our GI disease is treated the same way, whether it's
Yeah.
because it's actually pancreatitis or if it's, fill in the blank GI, you know what I mean?
Yeah.
Um,
And I think that's actually a really good point to bring up because historically, if an owner was short on money, I'd be like, don't bother testing for it because it takes 4 days to get back for the official test.
right,
Um, and like ultrasounds are now $700 to $800. That's a day and a half of hospitalization sometimes,
right.
and it's more important your pet to be hospitalized for some type of GI process, um, as opposed to doing all the diagnostics and not having money left over to actually treat the disease.
Yeah, and
So
we've seen enough of it, I think that or enough things similar, what and that's is always my hard part with this is like are we jumping to just call it pancreatitis, is it actually pancreatitis, and does it really matter because at some point the way we treat it doesn't really make that much of a difference.
yeah, yeah, I agree. It doesn't like, and I've seen cases where it helps, and this is an example where it might be very beneficial because if we get a diagnosis earlier, we start this medication. it can actually reduce the time your pet's in hospital. So there's a lot of nice things about this medication. And again, now we just got to get better at diagnosing it sooner. And because not everybody has access to an ultrasound machine. And
Well,
fortunately,
and our ultrasound like isn't that expensive, right? Like because where I am, thankfully, I can do a diagnostic ultrasound for less money than that.
that's a really good point. Sorry.
So there's
Yep,
that.
there's that. So yeah,
But actually, you
saving
make a
money.
really good point, Robert. I do think that makes sense. Like it might be another good reason to be able to really know if that's what you're treating, because if I can then refer them to someplace that has it, then it's like, oh, hey, you know what? Maybe this is going to truncate the amount of, so it's better for you to know what you're dealing with and know
Yeah.
that that's what you need. And I think you're supposed to try to get it to them in the first 3 days, or
Yeah,
is that
it's
later?
you
Okay,
start pretty early. I think you give a couple doses while they're in hospital, but
right.
yeah, I think it's like early. The earlier the better, because that's the whole point of like truncating it before it gets bad.
Do you think though that there'll be a change at all in how fast they push to put um feeding tubes, so the esophageal tubes like we were talking about in cats, we actually put a little hole in their neck and it goes right into their esophagus. I know it sounds barbaric, but they actually do great with it and they can keep them in for like up to a year. Like it's crazy.
Yeah.
They can keep them in a really long time and they do
Hmm.
awesome with it. They start eating around it. They don't even care it's there. Um but I wonder with the knowledge of how well you see feeding faster, and it's like been well documented at this point. Like it used to be
Oh
don't
yeah.
feed them, like that
Oh,
used to
which
be the thing, but now it's
yeah,
obviously get them eating fast.
yeah.
um I'm surprised that like the paradigm hasn't become, hey, it's worth it, get the feeding tube in the cat.
I think it's getting there now. Like our hospital does jump to it a little faster. Like as soon as it gets transferred to internal medicine, like they use a tube in that cat by the end of the day.
Because it's
So
not doesn't take, like, yes, they have to be sedated, like they have to be anesthetized, like they need
mhm,
a like fully intubated anesthesia to be able to put a feeding tube in properly. But
yeah,
if you've done a feeding tube, they're not hard to put in.
no, they're really not. It's like they actually like I think I could probably still do it. It's been a bit, but I can still do it. They're not complicated.
I can do it. I mean, I haven't done one in a little while, but I'm probably the only one that has done them at my practice because I'm,
Yeah.
I when they need them,
Dr.
and
Sam.
well, I'm just saying when they need them, and it can get them over the hump. You need them sometimes,
Oh yeah,
but they're not hard to put in. I mean, 10 minutes and they're in.
yeah. They're not hard to put in at all, and
Yeah,
I think it's a great tool. And it really does make a huge difference how quickly they can not only go home, because you can just start doing what you need to do from at home. You don't need us anymore, because you can
right.
give them fluids through that. You can give them their food through that. You can give them medications through it. So it really helps speed up the process of pancreatitis and makes
Yeah,
it's a heavy investment in the beginning, but I think it actually gets your patient out of hospital or your pet out of hospital sooner.
which ends up actually saving you money in the long run, because the longer that they're in hospital getting the
Mm.
intensive care, you're going to pay for that.
Oh yeah, especially if they become fatty liver, they're going to be there. Well, that's just a poor prognosis, just in general. It's not great. So I
Mm,
thought that too anyway. So yeah,
yeah.
pancreatitis. It's terrible. Don't do it.
Yeah, I know.
Don't feed your dogs
I
things.
know. So I'm like, to review the pancreas, you need it to digest things. And when it gets mad, it gets really mad. And if you're a
Mhm.
cat, you don't follow any rules, but they're usually not eating.
Mm.
And sometimes their temperature is low. Dogs, opposite, they are like, they usually have a fever.
They can.
Yeah,
I've
not
had
always
some
though,
people.
because I've
Yeah,
definitely seen ones that do not have a fever.
yeah. I would say it's not that's not a hard and fast rule, but I've seen them with fevers, and so it makes sense. Usually it's the really angry ones.
That
Um,
have a fever. See, those are
yeah,
the ones you see more than me.
yes, the angry ones. Those are yeah, they're terrible. Like, I remember I walk into like my ultrasonographer doing them, and she'd be like, "This is the angriest pancreas I've ever seen." And like I feel like she tells me that every other week now. It's like it's just they're getting worse. I don't know. It's like I said, it's not pleasant for pets, and it's like obesity I think has a large role in it. So I really encourage
Obesity,
owners
that's right.
to
Yeah. And I
and
think there are some rare but very, very serious complications. Like it puts you at risk for DIC. Um,
yeah, see acute kidney injury. That's a big one.
and there's some other crazy thing where like all of the fat in the body gets dissolved basically, like even like the in the brain, like it can like actually cause encephalopathy.
Yikes! That sounds. I didn't know that.
It's extraordinarily rare.
Okay, I was like, I've never seen it, but that sounds
Yeah.
horrifying. And
No, it is. And there's some other one where like it just like I don't know, causes even like skin eruptions. Like it's got a name, and I just was because literally I was reading about it because I was like I've only ever really seen mild things that we like suspect is like a mild pancreatitis, but like I'm
yeah,
not even sure it's pancreatitis. I'm just like, yeah, the pancreas is angry, but I don't, you know what I mean?
yeah,
Um, and that's about the extent of what I end up seeing. So I was like, well, let me just read and see, some of the other things, not to scare anybody, but it
I'm
it
scared.
does bear. I think anytime, especially your cat, if your cat's not eating for more than 2 days, they need to be
Don't
seen.
wait.
Like cats, they got to be eating or they'll get really sick, whether it's pancreatitis or anything else.
Mhm.
Dogs, I mean, they can go a little bit more, but if they're punky and they're like not wanting to eat, they're vomiting, they're sick, get them seen. I mean, the longer you wait for these types of things, the longer they're going to be in the hospital. Whereas if you can get ahead of it, usually you're going to be in a
Yeah.
better spot.
No, I completely agree. I think it makes a big deal of difference, and that's why we have a future guest coming up in a couple weeks with a cool way to monitor your cats if they are sick sooner.
Ah,
But it's not for a couple weeks now, so stay tuned.
oh, that's
Probably
right.
after the
That's what
first
you were
year.
telling me about. Yeah, that's kind of cool.
Yeah.
I
So
mean,
so
I
it's
think it's always fun to hear about the different ways that we can, like the things that people can do at home,
Mhm.
especially with like veterinary medicine getting more expensive and like some things you can't do at home.
Oh
But
yeah.
it is nice to know that like there are people who are working on innovative ways to like do something for owners to like give them some of that power back to say, hey, I can take them home and I have the ability to still help them.
Yeah, it's really awesome because I went to a conference recently and kind of a melting of the minds, or mending. Is it melting? Melting? No, I feel like I don't know what the saying was.
Melding.
Melding of the minds. Like that didn't sound right. Melting your minds. Melding of the minds, where a lot of people come together and they share like what they've got going on. And there's a lot of great things on the horizon that really going to improve the quality of life for our pets through like sustainable foods, new devices that your pets can wear to let you know when they're sick sooner. Um, the new tests that can diagnose diseases like years before they happen. So there's some really cool stuff in the future, and I'm excited to, well, we'll share some of those things with you guys, but you'll
Yeah,
also see them
whenever
just
we
through.
can, try to
Yeah.
present the problem. And I think that's one of our things. We'll talk about New Year's resolutions next time. But
Yeah.
um, but I do think, especially with like any device that could help you know that something's not going in the right direction. I had a patient today, just 6 cats in one house, and part of the problem was it was which cat is the one doing it,
Yeah.
and I don't know if the full extent of what's happening is clear sometimes when you have that many animals and they take a great care of their animals. It's not a
Oh yeah.
it's hard though. I mean, just like the more creatures you have to take care of. I have
Mhm.
3 children, a dog, 2 guinea pigs, and a fish. So the more creatures you have to take care of, the more your attention sort of split between them. So we were kind of talking about, oh, with 6 cats, she's like, it took me a minute to know that this was the cat that was having the urinary issue or whatever. And it's like,
Yeah.
yeah, it would be really cool to have something to be able to say, like, this cat's having a problem. And I know
Oh
it
yeah.
ahead of
It
time.
makes a huge difference. Because
Yeah.
I agree. It's hard. That's why I'm glad I only have one. I don't know how you guys do it with multiple little things you take care of.
All
Seems
the creatures. Yeah.
all the
I mean, at
creatures.
least the
It's like,
children can talk and they can tell me that they're having a problem.
yeah, that's true. That's true. That part's funny. Well, as we wrap up today, I think we should end on a positive note with the holidays. What's
Yes.
one thing that you want for Christmas?
Oh, um, time off to spend with my family.
Oh, that's a nice answer. Who does that? I want
That's
something
really all
greedy
I
and
want.
selfish. Who?
Okay, well, what do you want for Christmas?
Oh, easy. I want a Roomba that mops and vacuums at the same time. That's like the only thing I
Oh,
want.
that is a good one. I have that.
Oh, well, see, I'm catching up. I'm
But to
catching up
be
because.
to be fair, I don't. It's actually like it's called a Yeetie because I was like looking on Amazon for
Mhm.
something that mopped and did the like
Vacuums.
vacuuming, and it had all these good reviews, and I've never used the mop. I've only ever used the because I just don't have time to like get it to mop. Like I just was like the whole point of it is to be easy. So you're almost better off to have one that mops and one that vacuums instead of trying to switch like if I have to do the work to like take it from being a broom, I mean not like a vacuum to a mop, that's
Mhm.
just work I don't want to do. The whole point of it is that I want to be lazy and not do any work.
So I'll show you the new one I'm getting. My parents like, what do you want? I'm like, this is all I care about. You guys, and I'll chip in. I'll pay for the difference. Like, I don't care. But like, it does all that for you. Like, it just
Oh, it does. It like
extends.
just goes from one to the other.
Yep. So I'm
All
very
right, I'm
excited.
not that fancy. You'll have to tell me
Yeah,
about that one.
I'm very excited for it. So I hope you're listening, mom and dad. It's like the one thing I want this year. Santa Bear, come early, all right?
Okay, well, when you get it, you're gonna have to introduce me to it because ours, Wally, he doesn't really work that well.
Wally.
Wally, I mean, to be fair, I don't think we use him to his full advantage, but I'm not that impressed.
That's
Not that I want to say anything bad about a specific company, but I was like,
well, I will share my experiences with it when it comes in the mail, and if it does a great job, I will recommend it highly.
Okay.
Because
Especially if
yeah,
it does okay with Loki's hair, then it might actually do okay with Gus's hair.
exactly. I can't wait. I'm like, oh, save so much time. So yeah, here we go.
Yeah. Well, if you do have any questions or you want to weigh in on who had the better Christmas sweater, clearly the Frenchie wins.
Yeah.
Then you can always email us at podcast@mybalto.com. And if you have questions about pancreatitis, we kind of roll over the place today, but hey, it's
Yeah.
the holidays and we were having fun.
It's been a long week, guys. It's been a long
It has
week.
been a long week, but you know what? I enjoyed myself and I think you
I did
enjoyed yourself. So
always.
this has been the Pause It Podcast. We hope you enjoyed yourself too.